Hi, my name is Brian Williams, and I am a hospitalist, so I take care of patients when they're in the hospital. I work as both a pediatric hospitalist, taking care of children, as well as an adult hospitalist, taking care of adults. And I am thrilled to talk to you guys today about cigarettes, e-cigarettes, and vaping. Now I want to start with just a very simple activity where we all just stop and take 5 deep breaths. This seems sort of silly, but if you can bear along with me, and we'll take 5 breaths. Inhale. 1, 2, 3, 4, 5. Now that is really my whole goal, is for you all to breathe fresh, clean air and to keep your lungs healthy. Seems simple, may seem a little silly, but that's really my goal today. Now we are coming out of the COVID-19 pandemic. We're in the hospital. We have seen a lot of suffering and a lot of tragedy. And we know that people who are afflicted with health conditions, many of them the result of smoking or vaping, they're doing worse with COVID-19. All right, next I'd like to talk about the e-cigarettes themselves. Now all e-cigarettes work essentially the same. They contain the liquid, and that's the part of the e-cigarette that contains nicotine and all the chemicals that can cause cancer. They also contain a battery, and that battery heats a small metal coil that comes in contact with that liquid and turns it into a gas. A simple science experiment, right? So I've got a bunch of e-cigarettes here I want to show you. This one is sort of the initial first generation e-cigarette, meant to look largely like a traditional cigarette. You can see this part is the liquid, so there's liquid in here. You screw it in. This white part is mostly a battery. And then you're off and able to inhale all those toxins, that nicotine, straight into your lungs. You know, they've gotten fancier as the devices have evolved. This is an e-cigarette pen. You can see this clear section right here. You fill this with an e-cigarette e-juice. This is a device many of you may have heard about. This is called a Juul. So this has a small pod of e-juice that you stick right in and you're off in vaping. And then the other, sort of the newest device, is the disposable e-cigarette. So this is, as you can see, the exact same size as a Juul, but some of the laws have made these pods illegal, so you can't have flavored pods. Unfortunately, all the tobacco companies just changed and started making disposable e-cigarettes, because you can still put flavors in disposable e-cigarettes. These are particularly concerning because you use these once and you throw it away, and all these batteries, these toxins, are all ending up in our landfills. These devices still contain 3 major components. 1, they contain toxins. When you inhale from an e-cigarette, you get little particles. Some are small metals, some are different toxins, and they deposit in your lungs and cause your lungs to get inflamed. We know that even using an e-cigarette for a short period of time decreases how well your lungs function. The other major chemical in e-cigarettes is carcinogens. Now, carcinogens are chemicals that cause cancer, and we know that carcinogens are present when you inhale from an e-cigarette. The third substance in e-cigarettes that I'm really concerned about is nicotine. Nicotine is the toxic substance that causes addiction. So that gets your brain thinking, I want more and more and more, and you keep coming back for more nicotine, while also getting all those toxins and chemicals inhaled into your lungs. The challenge is that these devices are getting targeted at you. Cigarette companies, tobacco companies know that in order to have a lifelong customer who's going to pay that company money every time they use an e-cigarette or a cigarette, they need to start that person at a young age. We know that if you look at all the adults that are currently smoking right now, more than 90% of them started before the age of 18. We know that developing adolescent brain and all of its brilliance, we know you're brilliant, the brain when you're younger is much more at risk for becoming addicted to nicotine. If you start a 30-year-old smoking, the likelihood that they're going to become addicted to cigarettes is incredibly low compared to when you start a teenager. So unfortunately, e-cigarettes have really been targeted to look unharmful, to look safe, to look fun. You can see here, I've got this jar of e-cigarette juice. It's called strawberry flavored taffy. So they're trying to make this look like candy, make it look safe. I can tell you, there's cancer-causing chemicals in this fluid, so we want to think twice about using that. Me telling you e-cigarettes are not safe, are unhealthy, can put you at risk for lung disease and cancer, that's not the most important part of this. You are the most important part. We know that adolescents that use e-cigarettes are most influenced by their friends and their peers. So you have the power to decrease these vaping rates. You have the power to help your friends make the right decision and not use these products. You have the power to keep your whole generation safer and healthier. And I challenge you to think of creative ways to do that.